Hello, my name is Maria, and today I'm going to be presenting over yellow fever. So what is yellow fever? Yellow fever's main name is yellow fever, and it is also called yellow jack, yellow plague, and bronze John. Its official name is Flavivirus flaviviridae, and it is in general the acute hemorrhagic disease which causes increased fever and bleeding of internal organs. Its symptoms are very similar to the flu, and we will talk about this later on in the presentation. Okay, so now let's talk about the taxonomy of yellow fever. I put this chart in here to kind of help us understand how the family, how this family compares to other different types of families. So first, we start off with the RNA virus. In our case, it is single-stranded, so we go down here, and then we go down to positive sense. In our case, it is enveloped, so we go up here, and then we go to the negative side, which gives us Flaviviridae. Also, it is important to notice that there are other viruses within this family. There is West Nile, dengue virus, tick-borne virus, and Zika virus. Actually, West Nile virus is very similar to yellow fever because it is people become infected with this virus the same way that yellow fever does, which is mosquito transmission. West Nile virus is actually the leading cause of mosquito-borne disease in the United States. Okay, now let's talk about the characteristics of yellow fever. First and foremost, it is a virus. It is a RNA single-stranded virus with a positive sense, and it is enveloped. The size ranges from about 40 to 60 nanometers. And the virus infects monocytes, macrophages, Schwann cells, and dendritic cells. There are about 10,862 nucleotides in this virus, and it is a single open reading frame. There are three main types of proteins in this virus. There's E protein, M protein, and C protein. The E protein is in charge of attaching the virus to the receptors on the host cell. The M protein is helping with the proper folding of the E protein, and the C protein interferes with the cleavage of the long double-stranded RNA, since in our case, this virus does consist of RNA, whereas other viruses may not. Okay, now let's talk about the notable strains. Obviously, there are many different types of strains of this virus. Not all strains are going to be pathogenic. There are around 7 yellow fever genotypes, and they are organized into 2 different types of strains. 2 of these strains are found in South America, and 5 are found in Africa, specifically West Africa. The first type of strain is the wild-type strain, and this is found in non-human primates, and they are associated with the transmission from the jungle or the sylvatic circle that involves mosquitoes and monkeys. The second is a vaccine strain, and this is a strain where scientists use to grab the virus from and create the vaccine. It was weakened, so it doesn't have the full potential as a normal virus would, but this strain is called the 17D strain, and this is the one that was used for the vaccine. Okay, now let's talk about the yellow fever's pathogenesis. So this virus infects by attaching to the cell surfaces by specific receptors, and it's taken up by endosomal vesicles. So once inside the endosome, there is a decrease in pH, which induces a fusion of the endosomal membrane with the virus envelope. This then causes the capsid to enter the cytosol, and it decays and releases the genome, which is the genetic material of the virus. Both receptor binding and membrane fusion are both catalyzed by protein E, which we talked about in the past slide, and this changes its conformation. And once it enters the host cell, the viral genome is then replicated through the endoplasmic reticulum and in the vesicle packet. And the host range for this virus is mammals and most members of specific genuses. Now let's talk about yellow fever transmission. So how mosquitoes get infected. They are very small, but just because they are small doesn't mean that they can't transfer big diseases. Mosquitoes essentially pick up the infection when they are biting an infected host, and then the mosquito multiplies and develops the infection within its body's tissues. Then the infected mosquito transmits the infection through the saliva when it bites a healthy host. By passing on the virus, the mosquito acts as a vector of the disease, and it was found that the mosquitoes Aedes or Haemophilus are the mosquitoes that were found with the yellow fever virus. Okay, so the transmission cycle has 3 parts. It consists of the jungle cycle, the African intermediate savanna cycle, and the urban cycle. The jungle sylvatic cycle involves the transmission of the virus between non-human primates like monkeys and mosquitoes, species found in the forests. The virus is transmitted by the mosquitoes from the monkeys to the humans when the humans are visiting. Okay, next we're going to talk about the Africa intermediate cycle. So in this cycle, it's the transmission of the virus from mosquitoes to humans living or working in the jungle border areas. In this cycle, the virus can be transmitted from monkey to human or from human to human. So if a human is infected with yellow fever and a mosquito bites the human, then that mosquito travels and bites a different human and infects that human as well. For the urban cycle transmission, it involves the virus between humans and urban mosquitoes, primarily Aedes aegypti, which is the type of mosquito we talked about earlier. The virus usually is brought to the urban setting by a human who was infected in the jungle or savanna earlier on. Okay, now let's talk about prevalence and incidence of yellow fever. So yellow fever is mostly found in Africa and South America. Actually, recently there were a couple cases in Asia, but we will discuss that later on. Number of occurrences in the United States. Last seen was in New Orleans in 1817 to 1905 in that epidemic. This epidemic actually took more than 41,000 lives in New Orleans. Next, the number of occurrences worldwide are 200,000 cases each year, this being around again in Africa and South America. Death in the United States, last time we ever heard of death because of yellow fever was around the 1800s, around the Mississippi River system, which is New Orleans, Mobile, Savannah, and Charleston. Deaths ranged from 100,000 to 150 deaths, and deaths worldwide are about 30,000 deaths per year, again 90% being in Africa. Yellow fever is not the leading cause of death for an overall population, but it is an epidemic for subpopulations in Africa and some of South America. Outbreaks of yellow fever often happen when the disease is introduced to densely populated urban areas. This can have a major disruptive effect on both the economic and healthcare systems in that area. Okay, now let's talk about the history of this disease. So the first ever description of yellow fever was actually recorded in Mayan manuscripts in Yucatan, Mexico in 1648. They described it as a vomiting black blood and hematomesis. So Carlos Finley was a Cuban physician that first described the mosquito Aedes aegypti as a carrier of the disease in 1886. But no one really believed him until 20 years later, whenever he got to work with Dr. Walter Reed, who was a very well-known U.S. Army scientist. Once they worked together, Walter Reed confirmed that he was correct. How the virus was transmitted was through that mosquito. Whenever the first ever description of yellow fever was recorded, they weren't really sure on how this virus was being transmitted. They didn't really understand how people were getting sick and everything, so obviously it wasn't until later on when things started getting more advanced that people began to realize that this was because of something else, because of mosquito. Okay, so symptoms. The symptoms are similar to the flu. It actually takes a couple days for the symptoms to develop, about 1 to 4 days. The symptoms include fever, headache, muscle aches, nausea, vomiting, and sometimes even vomit blood. You get red in the eyes, face, and tongue. Your skin can turn yellow as well as your eyes. You have decreased urination, and you have irregular heartbeats. Excessive bleeding may occur, which can be very dangerous if this continues for a long time. These symptoms are obviously not going to happen to every person. Every person who does get yellow fever symptoms will be a little bit different just because of all of our immune systems are different. So the people at risk of this disease is infants less than 9 months, pregnant women, people with allergy, immunodeficiency due to symptomatic HIV or AIDS or other causes, and thymus disorder. Obviously, anyone can get yellow fever, but these people are obviously more prone. People old in age, above the age of 70, are also more prone to this because their immune systems are not as good as others. Okay, so diagnosis. You can be diagnosed with yellow fever two different types of ways. It can be assumed based on the places that the patient has traveled and the dates that the patient has traveled, and if there has been an outbreak in that area of yellow fever. Or it can also be tested in a lab. This can be done by testing of serum in order to detect the virus inside the blood and neutralizing antibodies. Yellow fever can be found in blood samples early on. I know that there are some diseases where this isn't the case, so it is very helpful that yellow fever can be found early on in blood samples if you catch it on time. Okay, now let's talk about the pathology of yellow fever. So yellow fever affects monocytes, macrophages, Schwann cells, and dendritic cells. Those are the cells that it usually affects. It does affect myocardial tissues that can result in hemorrhagic shock and causes damage to the liver, kidney, heart, and gastrointestinal tract, which obviously can cause many other issues. Okay, now let's talk about the immune response. So even though the vaccine is successful, little is understood about the mechanisms that produce the immune response, and there are different strains, and some of them were more difficult to work with and didn't provide a strong enough virus in order to be studied. Like mentioned before, the strain 17D was a strain that was successful in creating the vaccine. They discovered that inside of the strain there was a participation of many different types of cells like CD8+, or cytotoxic cells, CD4+ cells, T cells, macrophages, polymorphonuclears, antigen-presenting cells, and natural killer cells. Vaccination with this strain created an adaptive immune response and the creation of cytotoxic T cells along with a mixed T helper cell. Little is still known about the yellow fever 17D strain and its reaction with the innate immune response. Okay, so for treatments and vaccine, there is a vaccine for yellow fever. Like other flavivirus infections, there is no cure. You have to get the vaccine prior. It has not found to be helpful to get the vaccine after you already had the yellow fever virus. It has been found to not do really much. It is recommended to people who are 9 months or older and who are going to be traveling to areas at risk of yellow fever in Africa or South America. I do believe that in some countries they will not let you enter unless you have this vaccine. There are ways to prevent getting yellow fever, which is wearing thick long sleeves and constantly reapplying insect repellent. There are not really any treatments other than intensive care and rehydration and the use of acetaminophen. Doctors make sure to avoid aspirin and other non-steroidal anti-inflammatories. This is because it increases intestinal bleeding due to their anticoagulant effects. Future outlook. So unfortunately the disease is reemerging in Africa and South America, and now even China, due to not enough vaccines being provided. However, the CDC is trying to help the World Health Organization deal with the yellow fever activity in specific African countries by helping enforce protocols and informing people about getting the vaccine. Gavi is a sponsored yellow fever initiative group that works on reducing the risk of yellow fever epidemics by improving vaccination coverages in countries that need it most. Thank you.